Hello everyone, it's Wednesday, time for Wisdom Wednesday. Hope you all are doing well, and I wanted to share with you today some information that I've been gleaning from listening to the webinar series that Mark Hyman just did called the Longevity Roadmap. And he presented 7 days worth of webinars that addressed longevity and address health span versus lifespan. So we know lifespan is from birth to death, but within the lifespan, we want to optimize and extend as much of that time we call our lifespan and have that equal or as close to equal our health span, meaning that we're healthy that entire time. And of course, here in my office, our goal is to create health through lifestyle choices. And in this webinar, one of the things he talked about was a study that's been done in Europe called the EPIC study. Now, this study was what's called a prospective cohort study, where populations of people are studied. This is not an interventional study where we give something and then evaluate the outcomes of this intervention, but this is just studying people. So in the late 90s, 10 different countries recruited, I think it was around 521,000 people, and through questionnaires and medical histories and reports, they have followed these people since about 2000 to today. And so far we have quite a bit of information that we can process and put together and share. And so Dr. Hyman sort of brought this all together, and it has been shown through this database that there appear to be four simple behaviors that we can all do that reduce the risk of heart disease by 90%. And that's fascinating to me because these are very simple. And I'm going to walk through those. So the first thing is stop smoking. So, in my population, that's not a big issue at all, fortunately. And in today's world, smoking is not as prolific as it used to be, and that's certainly important. And we know that that's a huge just health risk factor. So stop smoking. Next, the recommendation is that you exercise 3.5 hours a week. And that's basically 30 minutes a day with 1 day of rest. And that's certainly doable, and you can break that down in a number of ways, but we'll talk about that as we look at exercise as far as what we can do to optimize our health. Thirdly, recommend eating a healthy diet. And even though there might be quite a bit of controversy over that, or what is a healthy diet, I know that with a lot of my patients coming in and they fill out their new patient information and think that they're eating a healthy diet, but yet when we take a deep dive and really peel back the onion, we know that perhaps there are ways that we can optimize nutrition by reducing carbohydrates, by reducing certain grains that can be inflammatory, reducing dairy that can be inflammatory. We are all different and our biologies are different, but there are certainly certain aspects of nutrition that are important for all of us to look into as far as optimizing our health, and not only just taking away the bad stuff, but putting good stuff in. Certainly eating whole foods and healthy protein sources are vital. And then lastly, maintaining a healthy weight. And we know that even though we have tables that calculate our BMI based on our height and weight, that certainly a healthy weight really is about percentage body fat and maintaining good lean muscle, and we try to do that testing here in our office as well to help shed light on that information. Now, why is all this important? Why do we want to do that? Because what we see in these studies, by doing these four simple things, you can reduce the incidence of diabetes by 93%. You can reduce the incidence of heart attacks by 81%. You can reduce the incidence of strokes by 50% and reduce all cancers by 36%, just these four simple behaviors. And this is important because the cost of medical care is overwhelming and continues to skyrocket every day. And despite the fact that healthcare is going up, our health is not getting any better. So we have to take action and be proactive in our own health and look to ways that we can really optimize that. And the big killers in this country are heart disease, the Alzheimer's, diabetes, and cancer. And it's thought that all of these chronic illnesses that are very costly and lead to significant health issues and longevity issues can all kind of be boiled down to possibly insulin resistance. And insulin resistance is thought to be at least certainly prolific, and it's thought that 85% of people actually have some form of insulin resistance, whether it's mild or not. But what that means is that our bodies require more insulin to manage the intake of food that we put into the body. And the liver has to process this, the muscles process this, and insulin is the hormone that is necessary for this to take place. And over time, with the standard American diet, it takes more and more and more insulin to manage the intake of food that comes in. One of the tests that we do every year for our patients is a test called the Hemoglobin A1C. Now, this is not a perfect test, but it does give us some insight into what people are doing from a dietary standpoint, because the hemoglobin A1C gives us a picture of the average blood sugar over the last 3 months. And it's our goal to try to keep that as low as possible. The test itself is a test measuring the hemoglobin molecule, which is that oxygen carrying molecule in our red blood cells. And it has an attraction for sugar or for glucose. And so this test measures how much glucose is attached to that hemoglobin molecule. And the higher that number, the more insulin resistance there is. It just gives us a little bit of a picture into what is happening. Also, fasting insulin levels can be helpful as well as just blood sugar levels. But the goal for us all is to keep that hemoglobin A1C low so that we know that our body is sensitive to insulin. And of course, the ways to do that are things that we've talked about already, by lowering carbohydrates, lowering sugar, getting rid of all the starches and processed foods that will contribute to that. So just a little bit of an insight, these four basic behaviors that can help us from a longevity standpoint: stop smoking, exercise 3.5 hours a week, maintain a healthy diet, and maintain a healthy weight. Now, over the next several weeks, we're going to continue to look at this. And as, of course, with all our Wisdom Wednesdays, we're always trying to talk about creating health. And we've been looking at all kinds of ways to do that. I'm going to take deeper dives, but I've been listening to lots and lots of lectures and seminars and experts in the field about insulin resistance. So we're going to kind of hammer on that, because we believe that really this is the underlying issue at hand. And even if all of you all who are patients are really working hard on this, maybe you can share this with some of your family members or friends who are struggling in these areas. But this is, the idea is that we can just stay well, stay out of the hospital. We know that people with diabetes and hypertension and all of the other comorbidities that are problematic with certainly COVID right now, we just want to do what we can to optimize the immune system. And by decreasing sugar and decreasing insulin resistance, we're going to be successful in managing to keep our bodies in shape where we can truly manage this. So that's all for today. Hope you all are doing well and continue to maintain your health, and look forward to visiting more about all these things as we move ahead in the year. Have a great day.